Hello everyone, welcome back to my channel. Today we will discuss mitral regurgitation. So first we will start from the graph how it looks like. So this is the point where mitral valve opens, but in mitral regurgitation the valve is incompetent, so it is almost always open. So from here, for suppose ventricle starts to eject, actually this is the point where left ventricle starts to contract. But as this is mitral valve is always open and incompetent, so blood will start ejaculating, but not into the aorta but into the left atrium backward flow, and so that's why there is no isovolumetric contraction or isovolumetric phase. So this graph will go like this, but it will not touch the highest pressure because the blood is back up into the left atrium. So somewhat this is graph looks like this, because the pressure in the left ventricle is not that much, and your stroke volume will be increased because the volume from the left ventricle is ejaculated into the aorta but also back into the left atrium. So this is the graph looks like, and I hope this is visible to you. So now let's go for the what happens in this situation. So in mitral regurgitation, as I already said, there is no true isovolumetric phase because because the blood is already going into the left atrium. Same thing happens in the aortic regurgitation. In aortic regurgitation, it is because the blood is going into the aorta, because at that time the aortic valve is incompetent. So there also is decrease in end systolic volume because blood going into the left atrium. There is increase in end diastolic volume, and this is because the valve is incompetent, and as the blood comes from the lungs, it directly goes into the left atrium, and then because valve is incompetent, it goes directly into the left ventricle. So you can see here the both graphs look very similar. It is the aortic regurgitation, this is the mitral regurgitation, but the difference is here the pressure is increased, here pressure is not that increased, even it is below the normal, and from here to here your stroke volume is increased. So these are the things, and now we will see what happens on auscultation. So in mitral regurgitation, you hear a hollow systolic high pitched murmur which sounds like this. And there are few things that you have to remember, that the loudest sound you hear is at the apex, which can you see in this picture where is the mitral area. And other thing what you have to remember for USMLE is the one exam, the radiation of the murmur, the sound where radiates. And now the mitral regurgitation's murmur radiate towards the axilla. Here I will add something, that in aortic stenosis the murmur radiates towards the carotid. Now we will move towards the causes. The most commonly it happens after MI. Other causes are mitral valve prolapse, which commonly we see in connective tissue disorders, left ventricle dilatation, and rheumatic fever. So this is the end of today's discussion. I hope this will be helpful for you. If you like, please share and subscribe my channel. Thank you. Stay tuned.